Good evening, all. Vinay, Rakshit, Sanjana, Lokesh, Neha Nayak, Dhananjay M, Hemant, Priyanka, yes, Kanav. Good evening, all. So, how is the preparation? How are you? How is the preparation going on? Srinivas, Srinivas Tota, good evening. Good. So, Neha, so let's start. So, today's session is the most expected questions. So basically university questions. So that is from injuries like mechanical injuries, thermal injuries, regional injuries, forensic ballistic and all. So we're discussing few questions, around 5-6 questions. Then at the end we'll have image based question as usual. So let's start. So before starting, one important sentence: don't stop when you are tired. Don't stop when you are tired. Stop when you are done. Stop when you are done. Okay? Till you reach your goal, till you reach your dream, don't stop. Your knowledge is your power. Okay? Work hard, study well, revise notes. That is your knowledge. That is your power. Okay? Vinay? Getting my point, Vinay? Yes. So now, to start with, मैं अभी शवा परीक्षा रूम में हूँ. You know, shava pariksha means autopsy, and there are two images. There are two images from the booth bungalow. The booth bungalow, that is basically shava pariksha room, I know, for normal people. There are two images are there. A 40-year-old died in unnatural condition due to high voltage burn, more than 1000 volt. He was basically electrician. He found dead with a multiple burn injuries. During examination, this is one image, and this is one more image. One more image. Can anyone tell me मौत का कारण क्या हो सकता है और मौत का तरीका? Yes, yes, come on guys. मौत का कारण, मौत का तरीका. Cause of death, manner of death. Okay. Yes, Vinay, great. Sanjana, try. Booth Bungalow series. We are starting Booth Bungalow series from next week. Look at this. Shava Pariksha room. Autopsy room. Yes, very good. So many answered. So this is basically electrocution. The cause of death is ventricular fibrillation. But in high voltage burn, so it can be respiratory paralysis. And the finding here, the crocodile skin burn, multiple nodules all over the body as a result of flame burn is known as crocodile skin burn. And the manner is accidental, I said already, accidental death. Okay, chal. So now let's start. The first important topic, very commonly asked in Viva, very commonly asked in your practicals and in theory, what is grievous hurt? What is simple hurt? Gambhir chot. So in Hindi we call it as Gambhir chot. मतलब गोर आघात करना, गंभीर चोट, that is known as grievous hurt. So describe grievous hurt, 5-mark question. You need to write all 8 clauses, 1, 2, 3, 4, 5, 6, 7, 8, along with one example. Very important question, very commonly asked. So before discussing topic, all of you write in the chat box, grievous hurt is equal to GH is equal to 116 BNS. Previously, it was 320 IPC, Indian Penal Code. Now it is changed to 116 BNS. Keep writing this, 116 BNS. Very important. So what is grievous hurt? So grievous hurt has 8 clauses. Very simple. The first clause is emasculation. The emasculation means the loss of masculine vigor. It is applicable to only males. So it is applicable to males only. Okay. So as you know, parasympathetic system causes erection, sympathetic causes ejaculation. So emasculation basically masculine vigor of a male. So when there is a damage to his testicles, amputation of penis, damage to lumbar spine, so that can lead to emasculation. So one example is amputation of penis. Okay, so that is grievous hurt. That is grievous hurt. The second one, permanent privation of sight of either eye. So very simple, it is permanent, not temporary. Privation means loss. Sight of either eye. So we have 2 eyes, either eye. So it can be partial or it can be complete. Take example, corneal scar, corneal tear, corneal scar is example. Third one, permanent privation of hearing of either ear. So example, tympanic membrane perforation. And the fourth one, privation of member or joint. In forensic medicine, the member means part of the body which has specific function. Like example, thumb has a very specific function. Amputation of thumb, amputation of limb, amputation of leg, so can be a member. So that is basically 4th class. Example, amputation of thumb. So there are basically 8 clauses. This will explain 4 important clauses. Okay, so now you need to identify what are these injuries one by one. So what is this 1? What is this 2? What is this 3 and 4? Grievous hurt or simple hurt? Just go through this. Grievous hurt or simple hurt? In image number 1, there is a damage to the genital region, basically. Image number 2, gouging out of eye. Image number 3, that is 4, basically showing tympanic membrane. You can see the tympanic membrane here. There is a perforation of tympanic membrane. And image number 4, there is an amputation because of the assault or because of accidental injuries. So what are these basically? So Vinay MR and others. Okay. So all these are basically grievous hurt. Now, the fifth class, destruction or permanent impairing of power of any member or joint. How to remember, 5 fingers. Fifth clause, power star, 5. 5, power star, loss of power of joint or member. Okay, like example, burn contracture. Wrist drop, foot drop. The sixth one, permanent disfiguration of head or face. So any scar over the skin of the face, disfiguration. So can be grievous hurt. And remember, acid attack also can lead to disfiguration. That comes under 124. 124. So all of you write in the chat box, acid attack. Acid attack is equal to 124 BNS. So there are certain facts are there in forensic medicine. There is no other way, we have to memorize. So 124 BNS is equal to the disfiguration of face as a result of acid. We call it as vitriolage. Oil of vitriolage, that is basically sulfuric acid. Very strong acid which causes very severe damage, which causes charring of the skin basically. Okay, so 124 is equal to acid attack. Very good. Vinay, Sanjana, Dhananjay, so all are answering. That's really nice. Great. So this is about the sixth. How to remember? So head, face, sixth sense. Sixth sense basically head or face. Then seventh, fracture dislocation of bone or tooth. So fracture of leg, fracture of radius, fracture of ulna. So any fracture, that is basically seventh clause. Or dislocation of teeth. So that is also basically grievous hurt. And the last one, very important one, all of you, very commonly asked in Viva, concentrate. Any hurt which endangers life, like example, stab injury or abdomen, it can be grievous hurt. It can be an example for attempt to murder, or which causes sufferer to be in severe bodily pain, very severe bodily pain for about 15 days, and because of that he is unable to do ordinary pursuit. These lines are very important. I'll repeat again. The clause number 8 has 3 subclauses. Endangers life, like example, stab injury or abdomen, severe bodily pain for about 15 days, and unable to do ordinary pursuit, like example, ordinary activities, so brushing teeth, so wearing clothes, so having food, taking bath, and all basically ordinary pursuit. It is not the official work. It is basically ordinary pursuit. Again, it's a Viva question. So all of you concentrate. So this is 8th one. So all of you write in the chat box, 8th clause is equal to 15 days. 15 days. Because previously it was 20 days. Previous IPC 320 20 था, 20 था. अभी क्या है? 15 है. 15 दिन का है. 20 दिन का नहीं, 15 दिन का है. ठीक है ना? Okay. So let's write in the chat box. Okay, that's fine. So this completes your grievous hurt. This is more than sufficient. Now look at this. There are 4 images are there. So all of you try to answer what are these images basically. So what is this image? And there is a nice photo of my favorite actress, Deepika Padukone. She acted in recent movie, and the movie name, if you want, you can mention. Then look at this. What is the finding here? This is the X-ray of the upper limb basically. That is distal part of the upper limb, and the last one you can see here, ordinary pursuit. So all of you, my guys, so what are these images suggestive of? Just try yourself one by one. Okay, good. Okay, the first one basically bone contracture. It can be grievous hurt as per power star 5th class, and this is basically disfiguration of face, vitreal age 124 and also 116. Then fracture 7th class, and this is going to toilet, very important ordinary pursuit, right? So this is also grievous hurt for about 15 days. We discussed all this, right? 7th, 8th and all. Great. Sutappa all answering. That's really nice. So great of you. Everyone is answering. I'm very happy. Good. Good. Srinivas Ramanujan Tota. Sanjana. Good. Good. Now I have very interesting clinical scenario. So just to make subject interesting, I have mentioned some beautiful names. Very famous name from old Hindi movie, Sholay. Sholay. He is basically Gabbar Singh, and he is basically Amitabh Bachchan. There is one clinical scenario. You must be knowing the lines of Sholay. जो डर गया समझो मर गया, जो डर गया समझो मर गया. So we are having one interesting scenario. So all of you, are you there to answer? All of you, my guys, how is the Josh in forensic class? डरना नहीं है. Your Josh should be very high all the time. Look at these lines given by Gabbar Singh lines, है ना? ठीक है. संजना, नेहा नायक, okay, ready? Yes, good, high. चलो ये देख के बताओ ये क्या आंसर होगा. Again, everything is hypothetical, guys. Nothing serious. Everything for the fun. So anything in fun is not an offense. Anything in love, not an offense. Yes. Gabbar Singh causes scratch abrasion of Amitabh Bachchan's cornea. Gabbar Singh, very strong villain. So corneal abrasion. Corneal abrasion can be grievous hurt, loss of vision. Okay, leading to permanent loss of vision and partial loss of vision. Partial loss, complete loss doesn't matter. So Gabbar Singh offered for corneal transplantation. Gabbar Singh है ना, ठीक है, तो he offered basically corneal transplantation at his expenses. He said, Amitabh Bachchan, you don't worry, I am there to help you. I'll pay you all the expenditure, whatever related to corneal transplantation, you don't worry. Then, now Amitabh is able to see very clearly. Now Amitabh Bachchan is clearly everything fine, no problem. Now they are friends. My question is, the true about above scenario. Gabbar Singh is not guilty as he agreed to pay expenses of corneal transplantation. Gabbar Singh is not guilty as vision loss is temporary and partial. Gabbar Singh is guilty of hurt. Gabbar Singh is guilty of grievous hurt as per 116 BNS. ये कौन बताएगा? चलो विनय, what is the answer? Okay. So the answer given by many of the students, the first two answer is Vinay MR. So Vinay MR from Subbaya Medical College. Very good, Vinay MR. Great. Great answer. He is the first to answer. ठीक है? So good. Rest all answered. That's great. So many they answered. That's great. Chal, next. The next question. So I hope you understood grievous hurt. All of you okay? Grievous hurt okay? Have you understood? So grievous hurt means serious injury. Okay. Gambir chot I said. And there are 8 clauses. The clause 1, that is emasculation. Clause 2, eye. Clause 3, that is basically ear. Inner ear, outer ear and middle ear. Class 4, member, fourth member. Class 5, power star. Class 6, disfiguration of face. Class 7, fracture dislocation or fracture of the bone or the dislocation of tooth. Fracture 8, endangers life. Ordinary pursuit for 15 days, severe bodily pain. 116 BNS. So this is how they're going to ask question in exam. Pakka question in Viva, pakka question in practical. This is the way you need to answer. Yes, guys? Yes, good. Okay, all of you guys, say yes or no. Now we are discussing about mechanical injuries. Classify mechanical injuries, define abrasion, types, medico-legal importance. So sometimes they'll ask about bruise, sometimes they ask about laceration, incised wound, then sometimes they can ask, basically stab wound as well. Anything can be asked. Okay. Now let's start one by one. Now here is the blunt weapon. All of you guys, so here is the blunt weapon, cricket bat. Now can anyone tell me what are injuries caused by blunt weapon? Yes, come on. Blunt weapon. So that is one thing. Then this is sharp weapon. What are injuries caused by sharp weapon? Like this, like this, like this, like this. Yes, come on. Try yourself. Then what are injuries caused by? What are injuries caused by that? Come on, guys. Come on. Try yourself. Okay. That's great. So many answer. That's great. Okay. So in exam, you need to write like this. Blunt force injuries. So many answered. I'm very happy about it. You are talented. You are talented. You can achieve whatever you wish, whatever you dream. Work hard. So blunt force injuries, abrasion. So abrasion is the most common one. Then contusion, laceration, fracture, sharp force inside, chop wound and stab wound. Then firearm injury, firearm wound and blast injury. So this is the broad classification. Let's discuss overall about the mechanical injuries briefly. So abrasion is the most common mechanical injury. So there are 4 types of abrasion. There are 4 types. So what are 4 types? So type number 1, scratch abrasion, graze abrasion, pressure abrasion, imprint abrasion. So there are basically 4 types. The commonest one is graze abrasion. The most common abrasion is graze. It is also known as brush burn. So you will see parallel lines of abrasion. The scratch abrasion is like a lines, like this, lines. The graze abrasion looks like this. So pressure abrasion commonly seen in hanging. Imprint abrasion, example, tire mark. Imprint abrasion and pressure abrasion, they both come under pattern abrasion. Again, the 3 marks question. What are pattern abrasion? 3 marks question. So your answer must be, it is divided into pressure abrasion and imprint abrasion. So you will get to know the imprint of the weapon basic. So there are basically 4 types. So medico-legally, abrasion is very important, especially in case of sexual assault. So especially in case of grievous hurt, simple hurt, pratyurism, assault, in all these cases, abrasion is very, very important. Okay, so good. Then contusion, also known as bruise. There are again different types. So what is important is color change. The color change of bruise. So what happens immediately? Red color, red becomes blue. So blue becomes that is brown color. So brown becomes green color. So green become yellow color, normal color in 2 weeks. Color change is very commonly asked. So there are different types are there. So one type commonly asked is deep bruises. Deep bruises, also known as delayed bruises, migratory bruises, superficial bruises, then migratory superficial, intradermal bruises known as superficial bruises, tram track bruises, tram track bruise, all these are contusions bruise. The color change very important, and again 3 marks question, artificial bruise. So what are the plants that lead to artificial bruise? Plumbago rosea, Hemicarpus anacardium, and Calotropis. So very commonly asked. Laceration. Laceration is because also known as tear. Tear in the skin, tear in the mucous membrane. Okay. So again types, prick laceration, cut laceration, tear, stretch laceration, Owl's laceration. Owl's laceration. Very commonly asked. 3 marks question, split laceration. So split laceration looks like an incised wound. It is also known as incised looking laceration, commonly seen over bony prominences. You will see tissue bridges. Laceration. Then fractures, basically skull fractures. So what are the types of skull fractures commonly asked? So what are types of skull fractures? Types of skull fractures. One is linear fracture, ring fracture, hinge fracture, depressed fracture, pond fracture, perforating fracture, gutter fracture. So there are different types. So again 3 marks question, skull fractures. Then sharp force injuries. So again incised wound, commonly asked. So incised wound can be cutthroat injuries. So very commonly asked, cutthroat. Five marks question. Difference between suicidal cutthroat and homicidal cutthroat injury. Incised wound. Then chop wound. So chop wound, there are findings of incised wound and laceration both caused by heavy object. Heavy object. Stab injury caused by pointed weapon. Again, there are 3 types are there. 3 P's. 3 P's. What are 3 P's? Yes, let's ask. Sanjana, what are 3 P's of stab injury? So P for penetrating. P for perforating. P for punctured. Punctured. So all these are basically stab injuries. So in stab injury, depth is maximum. Then firearm injury. So firearm can be a rifled firearm or smoothbore firearm like shotgun. Entry wound, exit wound, very commonly asked. Then comes is the blast injuries. So blast injuries. 3 marks question can be asked. What are types of blast injuries? Good. Now, what are the injuries caused by air blast? Can anyone answer? What are injuries caused by air blast? Now look at this. Just to make you understand, there are balloons are there and there are air is there. Okay, I don't have any blast material. I have only the balloons. So can anyone tell me What are the organs commonly affected by air blast? Come on guys, air blast. Blast. What are types of blast injury? Try. So happy Diwali in advance. Wish you very happy Diwali in advance, Vinay and others. Hemant. Good, many answered. Sir, common organs affected. Sanjana Lokesh, it is not liver and spleen. Common organs affected are middle ear. एक तो middle ear है, के बाद lungs होगा, then your intestine. So middle ear, then your intestine and the lungs. So they are basically primary organs in air blast. So in water blast, underwater blast, again it is intestine. In solid blast, basically fractures, skeletal injuries are common. So blast injuries are classified into primary, secondary, tertiary, quaternary and quinary. So primary caused by the blast wave. Secondary caused by the moving projectiles or flying missiles. Tertiary because of the victim displacement. Quaternary is because of the structural damage. Quinary is because of the radiation. So there is a flow chart is there, you can go through after the class. So this is the broad classification of mechanical injuries. Mechanical injuries, okay? Yes guys, wish you happy Diwali in advance with these two balloons, pink and yellow, okay? हाँ, चल. Now look at this image and try to answer. Yes, Aishwarya, thank you. Look at this image. This is a dead body in autopsy room. So we are in the Shava Pariksha room, Shava Pariksha autopsy room, Booth Bungalow. So in Booth Bungalow, history of road traffic accident. Road traffic accident. He got multiple injuries, head injury, and blunt force trauma basically. And during examination, this is the finding. So in the finding, what you can see here, parallel lines like this. What you can see here, parallel lines, which is one of the commonest injury in road traffic accident in forensic medicine. What is this basically? Good, many answered correctly. So the first answer is by Muhammad Ayush. Good, Ayush. It is basically graze abrasion. Good. And one more importance of this is you can identify the direction by looking at the heaped up epithelium. Now here what we can see here in this graze abrasion, so all these are heaped up epithelium. So like this injury is there. Okay. Heaped up epithelium. Now my question is, what is the direction? Right to left or left to right? Right to left or left to right? Srinivas. Yes, it is basically the heaped up epithelium normally present at terminal end. So that's why it is from right to left. So right to left, many answered. That's great. Then look at this now. Again, we are in the Shava Pariksha room, in the Booth Bungalow room. During examination of sexual assault, a case of sexual assault, I found some injury like this. This is the injury, and the DNA sample was taken from this. My question is, what type of abrasion is this? What type of abrasion? So you can see the clearly visible bite mark. Looks like a human bite mark. You can see here human bite. All 32 teeth are there. This is how abrasion is very important in crime scene. So abrasion can tell you about the Manner of death. So this is a case of sexual assault, and this is basically bite mark. What is this? Patterned abrasion, also known as imprint abrasion. And this imprint you need to match with the teeth of the accused. So dental teeth, okay, dental cast of the accused, and DNA sample also can be taken from this. You need to preserve this sample, okay, swab basically. Then again, we are in the crime scene now. So in the crime scene, so we got some weapon here. This is a weapon, and what you can see here is the cartridge. You can see the cartridge here. So cartridge has a base, it has a gunpowder, it has a primer, it has multiple lead balls are there. So multiple lead balls are there. Lead balls. Okay, it looks like this. It looks like this. So this is the base, and this is the wad, and this is the gunpowder. Gunpowder. So what is this basically? Good, Srinivas, good. So many answers. Srinivas is first to answer. Srinivas, excellent answer. Srinivas said, sir, it is shotgun. So this is basically shotgun. Shotgun. The range of shotgun is 40 meters. It is a smooth bore firearm. So this is the structure of shotgun cartridge. So from the below, primer, base, gunpowder, pad, and lead balls. 3 marks question. So rifling is absent in shotgun. It is a smooth bore weapon. Rifling means presence of lance and grooves. Next. Look at this. This is one more image just to make this subject interesting. This is taken from KGF 2, Rocking Star. I know. I think you must be knowing the name of this weapon. I think some name is given to this. What is the name given to that weapon? Can anyone tell me? Can anyone tell me what is this firearm? What kind of firearm? What is the range of this firearm? Okay. Try. Sutapa is telling, sir, rifle, machine gun, है ना? Bojala, हाँ, very good, है ना? Dodama nahi, Dodappa nahi, Dodama. So something like that, some dialogue is there. Even I forgot, old movie, no? So yes. So basically it is 1 to 3 kilometer. You know, this is one very important question, and this is rifled firearm. Rifled firearm. Whenever word rifled, lance and grooves are there. When lance and grooves are there, it increases velocity. It increases penetration power. It increases range. So it can cause more damage in the crime scene. So around 1 to 3 kilometers. Some student answered 1 to 3 kilometer. Okay, good. That's great, Srinivasa and Priyanka. That's great answer. Okay. Now I have very interesting question. The favorite of university exam. What are differences between entry wound and exit wound? Entry wound and exit wound. Okay. Like example here. So this is contact shot. Okay. What are the features of entry wound? And opposite side there will be exit wound. Are like this: entry wound, exit wound. Very commonly asked 5 marks question. Simple actually. Very simple. Very simple. Let's see one by one. There are 10 important differences in exam. You must write all 10. What are the features of entry wound? So just try to remember entry wound. Exit wound you can write in the exam. So entry wound is having abrasion collar. It has abrasion collar. So surrounding the entry wound, there will be abrasion collar. So example, this is the entry wound. This is the entry wound. So you will see this is abrasion collar. Abrasion collar is because of spinning movement. Spinning movement. Okay. Then comes is grease collar. Grease collar known as dirt collar. So it is also known as bullet wipe. It is because of the dust particle or because of the grease that is present in the barrel. So this is grease collar. So this is grease collar. So then comes is blackening, also known as soot particle, also known as smoke particle, smudging, soiling. So this is basically blackening. So this is basically blackening. So the blackening is because of the soot particles. Again MCQ. Then surrounding this we have superficial wounds. So we have some certain superficial wounds. So like this, superficial wounds are there. Okay. So this is known as tattooing. So tattooing is because of unburnt gunpowder. Unburnt gunpowder, very commonly asked. Unburnt gunpowder. Gunpowder can be smokeless gunpowder, semi-smokeless gunpowder, and smokeless gunpowder. Okay, black gunpowder as well. So singeing of hair, that is a feature of entry wound. That is absent in exit wound because of the heat. Inverted margin. So entry wound, inverted margin like this. Inverted margin. Everted margin in case of exit wound. Inner table beveling. In case of entry wound, inner table beveling. Exit wound, outer table beveling. Muzzle imprint in case of contact shot. Contact shot. Small. So entry wound is always small. Exit wound is larger. One exception is dum-dum bullet, also known as mushroom bullet. And the last one, bleeding is less. In entry wound, bleeding is less. In exit wound, the bleeding is very high. So all these are 10 important differences between entry wound and exit wound. Okay? Yes. So this is very important funda. Chalo, now let's have discussion about some image based question. Now see, I am in booth bungalow now. मैं हूँ autopsy room में. So a case of firearm injury. The cause of death is shock and hemorrhage. A case of murder. So this is the photo of the dead body. This is the finding in the dead body. Look at this. What are the findings are there here? Look at this. So this is a case of murder. Okay. Can anyone tell me what is this basically? What is the finding there? Okay. So you can see the grease collar. So you can see the grease collar here. And also you can see the blackening. So blackening. You can also make out abrasion collar. Abrasion collar. Okay. Then look at the skin. Skin, if you see the skin, can anyone tell me what is the finding in the skin here? What is the finding there in the skin? Try. So this is basically singeing of the hair. Singeing of the hair because of the heat. So this is how you need to answer in exam. Good, that's great. Then we have one more picture here. Again, the finding here, look at this. There is a finding here. And what is the finding here? It looks like a suicidal entry wound, or it can be homicidal entry wound also. Look at the inner table and outer table. So here outer table is more damaged. Here inner table is more damaged but not visible. So you will get to know only opening the skull. But it looks like oval. Inner table is more removed. Here outer table is more removed. What is this basically? So this is basically entry wound. ये एंट्री वुंड होगा क्योंकि इनर टेबल बिवलिंग है. इसमें क्या है? आउटर टेबल बिवलिंग है, इसलिए एग्जिट वुंड होगा. एग्जिट वुंड. ठीक है? ओके. So one more important funda you need to memorize. So contact shot, what are the finding? Close shot, what are the finding? Near shot and distant shot. In general, ranges we call it as range. In contact shot, you will see muzzle imprint. Muzzle imprint. Then stellate shaped entry wound. Star shaped entry wound. Contact. क्लोज में आपको मिलेगा ब्लैकनिंग. नियर शॉट में टैटूइंग मिलेगा. टैटूइंग. And distant shot nil. So in distant shot you will see inverted margin and you will see inner table beveling of entry wound, any entry wound. So this is commonly asked in the exam. Okay. Yes, good, Sanjana, all answering. That's really nice. Okay. Now all of you try this. Try what is the range here? What is the range? So what is the range here? So this is basically contact shot. Contact shot. That's great. Then look at this. 2.5 to 7.5 centimeter and blackening is there. What is this? Close shot. And this is 60 centimeter up to 1 meter or 60 centimeter. So this is near shot. So anything more than 60 centimeter, we call it as distant shot. Okay, distant shot. So this is what given in KSN Reddy. So what are the features of entry wound? What are the features of exit wound? Commonly asked. Okay. Okay, this completes your classification of mechanical injuries and difference between entry wound and exit wound. So all of you okay? Have understood? Take it. Yes, Vinay? Okay. So the next question is classify thermal injuries. Very, very important. And explain rule of 9. One example is, this is the injury that is caused by hot coffee, so which is known as scald. The question is classify thermal injury and also explain rule of 9. Very, very important. So what is the classification? So let's see from the standard textbook. Before that, can anyone tell me what are diseases or what are the clinical conditions caused by extreme heat? Extreme heat more than 42, I know. And what are the injuries caused by extreme cold? General cold. I'm giving you the question that is basically general cold. Local cold nahi, general cold. So देख के बताओ, can anyone tell me? Let's see. Sanjana, Lokesh, Rakshita. 3 condition caused by heat, 2 condition caused by general cold. Srinivas, they are all local injuries. My question, general heat, general cold. Say example, you are in Himalaya today. Very cold Himalaya, sir, like this. Or Delhi, very hot, very hot. So what are the condition caused by general heat and general cold? Okay, so general heat basically 3 injuries. One is heat cramps, heat syncope, and heat stroke. Heat stroke. The heat stroke is also known as sunstroke. Remember, in sunstroke and heat stroke, sweating is absent. So write this in chat box. Heat stroke, sweating absent. Because when body temperature more than 40, 42, so there can be failure of hypothalamus and higher brain centers for heat. So there will be no heat regulation. So there will be no sweating. So this is very important MCQ. Sweating is absent in heat stroke, sunstroke. Then what are the injuries caused by cold? I think nobody has answered. So general hypothermia, extreme hypothermia. So there can be 2 important clinical conditions. One is paradoxical undressing. So what is one? Paradoxical undressing. Point number 1. The second one, hide and die syndrome. Hide and die syndrome. So in both the condition, because of extreme cold, so there is a inhibition of higher center, damage to the higher center. So the person feels very hot from inside. Then there will be undressing, paradoxical undressing. Sometimes it looks like a sexual assault and death in case of female. Hide and die syndrome. Sometimes he will hide under the pillow, under the bed. So because of some hallucination, because of some insanity in hypothermia, that is known as hide and die syndrome. Okay, so this is very, very important. So hope you understood this. These 2. Chal. Then this is what classification given in standard textbook. If you want distinction mark, if you want gold medal in university exam, if you want to acquire good knowledge in forensic, you need to write like this from the standard textbook. Thermal injuries classified into cold. What are cold injuries? Hypothermia, general hypothermia. I discussed already. Hide and die syndrome, paradoxical undressing. Local effect. What are local effects? Frostbite. So in frostbite, there will be gangrene. Gangrene. Trench foot or immersion foot. In trench foot, immersion foot, so there will be pale appearance. There is no gangrene. So commonly at 5 to 6 degrees Celsius. Okay, so trench foot. And some books gives other injuries also. Okay, so timing you can write frostbite and trench foot. Then comes is the heat. Very important. General effect. So general effect, either it can be heat stroke, heat cramps, and heat exhaustion, syncope also. Local effects, dry heat, basically burn injuries. Moist heat, basically known as scald. Can anyone tell me how to differentiate between scald and burn injury? How to differentiate between scald and burn injury? Scald is caused by moist heat. Dry heat causes burn injury. How to differentiate clinically or in autopsy room between these two? So blisters are there in both the condition. Blisters in both burn injury as well as scald injury. Acha. Okay, Srinivas is telling, sir, it is watery blisters, and it is above the injury in case of scald. Okay, that's fine. Soddening and bleaching, very good. Ayush is telling, sir, soddening and bleaching. Ayush, excellent answer. Ayush, soddening and bleaching, that occurs in case of scald injury. That is absent in case of dry heat, that is basically flame burn. So I think Mohammad Ayush from MAMC, Maulana Ajaz Medical College. Yes, Ayush. Yes, sir. Gaurav Kapri. Mohammad Ayush. So I'm also from your college. I'm your senior, super senior. MAMC, MAMSite. Okay. Hi, Ayush. Happy to see you. Okay, good. MAMSite are here. Some students from BMC, MMC, government colleges, private colleges. You are all very lovely students, very lovely and very, very attentive students. I'm very happy about it. Okay, good. Acha, ragging? नहीं यार, ragging is non-bailable offense, cognizable offense. No, ऐसा नहीं होगा. We are friends. We all are friends. No junior, no senior, nothing. We are friends. We are human beings. ठीक है? Good. ठीक है. ठीक है. Naya Nayak, you also said that's great. Naya Nayak, good. Good. VV Pillai, okay. Fine, it's a good book. Toxicology, I think it's good. So, okay, Rakshit is telling us a trickle pattern. Okay, Rakshit, good. Okay, that's great. So this is what the thermal injuries. Then rule of 9, very important. So rule of 9 introduced by A.B. Wallace in 1951. So this is asked in one of the entrance exam. Rule of 9 invented by. So just write rule of 9 is equal to Wallace in chat box. Okay. Basically, he was surgeon. He was not autopsy surgeon, general surgeon, and at Edinburgh, around 75 years back, long back. Okay, good. Again, you know, rule of 9 is very important. It is very important for prognosis. So very important for prognosis, and very important to estimate the amount of IV fluid needed, especially to measure IV fluids needed, and also to find out surface area, and also surface area. So 3 important applications of rule of 9. It's very simple method. It helps in prognosis. Okay. It also helps in Parkland formula, ringer lactate administration, then surface area in case of autopsy. Other rules are there, basically LB formula, in case of children, Palmer rule in scattered burn, okay, good. So this is very, very important, Srinivas and others. So that's great. Good. You can write about LB formula. You can go through the textbook. Then Palmer rule, 1 palm is equal to 1%. So the palm of the patient, not the palm of the doctor. Again, it's a Viva question. The commonest cause of death in case of burn injury, either neurogenic shock or septic shock or hypovolemic shock. So more than 3 days, basically septic shock. So immediate death, neurogenic shock or hypovolemic shock. So it can be antemortem or postmortem. So antemortem, line of redness, tooth particles, blisters containing protein, carboxyhemoglobin in the blood. So all these are the features of antemortem burn, very, very commonly asked. So after the class, go through antemortem burns. And one more commonly asked is, what are artifacts in thermal injuries? Artifacts. So what are artifacts in thermal injuries? Artifacts means unreal thing, which mimics like a natural thing. It also affect your diagnosis and cause of death. What are artifacts? Can anyone tell me? क्या कोई बता सकता है? ठीक है, रक्षित. हाँ, very good, Hemant. Sir, artifacts basically heat stiffening. Heat stiffening can be antemortem and postmortem, known as pugilistic attitude, because of the coagulation of protein when body exposed to more than 70 degrees Celsius. Then heat ruptures, also known as heat splits. Then heat hematoma. So there are basically 3 important artifacts. Hematoma. In hematoma, it looks like a honeycomb appearance with a gas bubble inside, which is bilateral. Looks like an extradural hemorrhage. Ruptures, you will see intact nerves and the vessels. And stiffening, that is boxing attitude, pugilistic attitude. Okay. So these are very commonly asked in the exam, 3 marks. Good. So what is rule of 9? So this is rule of 9. So what you can see here, the back of the head 4.5, the front is 4.5. Okay, front and back. Pudendal area, pudenda is 1%. So now here area of confusion is, what is the surface area that is involving upper limb? One upper limb and one lower limb. Let's see who is going to answer. One upper limb and one lower limb. Yes, so good answer. So one upper limb is 9% and one lower limb is 18%. That's great. So that's great. So many answered correctly. This is basically 9%. This is around 18%. So upper limb around 9%, and one lower limb is around 18%. Okay, 18. So this is the area of confusion. Again, upper limb divided into, so 4.5 and 4.5. Some say 4, 4 and 1. 4, 4 and 1. 4, 4 and 1. Like that. Okay. So this is very important for calculation. Sometime in your Viva, sometime in prof exam, MCQ can be framed. So this is very helpful. So front of face 4.5, back of face 4.5. So then rest all area, front of chest, front of abdomen 9, 9, front of lower limb is 9, but front of the upper limb is basically 4.5%. Back is around 4.5%. So pudendal area 1%. Okay, so after the class, you just go through these most expected questions. So they're all commonly asked in CBME. Any university, RGHS, NTR, any Delhi University, any university, these are all very important questions. Either 3 marks or 5 marks. Okay. So one is classify skull fractures. Very important. Classify skull fractures. Linear fracture, pond fracture, hinge fracture, types of hinge fracture and all commonly asked. The most common linear fracture. Then transportation injury. So what are primary impact injury? What are secondary impact injury? Secondary injuries and all. So 3 marks. It's given in Farre book. You can just go through that. Then electrocution, 5 marks. So basically, the entry wound, exit wound, cause of death, AC, DC, antemortem, postmortem and all commonly asked, electrocution. So electrocution can be suicidal, homicidal, accidental and judicial. So for every question, you must write medico-legal importance. So आपको medico-legal importance लिखना ही पड़ेगा to get good percentage. Okay. Then death due to lightning, 3 marks. Then very important question, artificial bruise. Not a natural bruise, artificially created. Then aging of bruise, 5 marks. Then very important main question, cutthroat injury, suicidal, homicidal. So can anyone tell me, so what are the features of, what is one important feature of suicidal cutthroat? Suicidal cutthroat. Now this is sharp weapon. This is for only for the purpose of lecture, for education. Now my question is, what are the features of suicidal cutthroat injury? Like this or like this, like this. Come on. 1 point. 1 point. Yes, come on guys. So one is carotid artery. ठीक है. और hesitation cuts कौन बताया? Srinivas, very good. Vinay also answering. So basically it is hesitation cuts. Hesitation cuts. And also direction. Can anyone tell me what is the direction in suicidal right hand person? It is from above downward or downward to upward. Above downward or below upwards. ठीक है, try. Okay, good. So Mohammad Ayush is telling, sir, it is above downward. And Aishwarya Bangar, Vinay M, everyone is telling, sir, it is above downward. That's great. That's great. All of you, great. Hello. Then comes is your injury. Definition of injury. Okay. Very important. So 3 marks question. Definition of assault and definition of hurt. So three important definitions. One is to grievous hurt, very commonly asked, बहुत important है. एक होगा injury, assault and hurt. Then comes this important question, antemortem and postmortem injuries. So what are the difference between antemortem and postmortem injuries? So one very important difference is vital reaction. So when you see line of redness, when you see vital reaction, signs of inflammation, antemortem. When signs of inflammation not there, then it is postmortem. Like enzyme histochemistry. You must be knowing in inflammation. So there are many enzymes that get rises at the site of inflammation in a living person. So that is a important aspect of antemortem injury. This is commonly asked. So these 12 questions, no doubt, very commonly asked. Just revise. You can go through entire book if you have time, or else go through these questions first. Then you can go through your other important topics. Okay. Good. That's great. Chalo. So now we are going to start the last session, image-based questions. So all of you, my dear students, are you ready? Ready for the final image-based sessions? Say yes or no? Yes or no, guys? Come on, try. Say, how is the Josh, my dear student? How is the Josh, my dear students? Your Josh should be very high in forensic class. So your teacher is very energetic. You also should show more energy. Okay? Energy. That is what required in forensic class. Come on, guys. Come on. Try. Okay. Amazing. Some are telling, sir, amazing hai. Tota is telling, sir, absolute. Best. Okay? Good. Hello, let's start now. So let's start. So the first question, and as usual, you know, so you need to identify and you need to tell about the answers for those questions which I am going to ask you, not the random. So the first question comes is, this is the first question. So now I am in the Booth Bungalow, Shava Pariksha room, and this is a case of road traffic accident, and this is an hematoma which is there. So my question is, identify this and what is the medico-legal importance? आपको आइडेंटिफाई करना पड़ेगा और बताना पड़ेगा मेडिको लीगल इंपॉर्टेंस क्या है. ठीक है? MLI, AMLI. Yes, try this. Okay. Okay. Yes. Now answer discussion. Yes, many answered correctly. So it is the dura mater. So what we can see here is the dura mater, and this is middle meningeal artery. And this is hematoma. So this is basically extradural hematoma. So it is above the dura mater, extradural hematoma, because of bleeding from middle meningeal artery. So the answer is extradural hematoma, point number 1. So then medico-legal importance. So one is lucid interval. Lucid interval commonly seen in extradural hemorrhage. It can be seen in SDH also, very rarely. Then it is commonly seen in road traffic accident. And most commonly it is unilateral. It never crosses suture line. It is within the suture line. And CT scan finding is biconcave or biconvex appearance. Okay. And one more thing, it resembles like drunkenness. Drunkenness. If you discharge the patient during lucid interval, it can amount to medical negligence. So this is the answer I wanted. Okay, good. So many answered, that's correct correctly. So dilated eye, alcohol intoxication and all, many answered. So that's really nice, guys. That's really nice. So this is first image. So second image, before that, so try to memorize this. Try to memorize. So this is extradural hematoma. So this is the CT scan finding. So this is lemon shape. Lemon shape, biconcave shape. That is in case of extradural hematoma. This is subdural hematoma. It looks like a banana. Subdural hematoma, banana. Okay. So all of you write in the chat box. Lemon is equal to EDH. Banana is equal to SDH. Keep writing. Yes. Keep writing this. And EDH is because of middle meningeal artery. STH because of bridging veins. And this STH is common in old age. Common in alcoholics. And boxers. Boxers. In shaken baby syndrome. And in child abuse syndrome. Like this child abuse, everyday child abuse like this, na? It can lead to, that is basically SDH. So all these are very, very important points. Okay. So in forensic medicine, we have three important things just to make subject interesting. So one is apple. One is your lemon, already discussed. And what is this? This is banana. Can anyone tell me what is that related to apple? Apple. Apple, apple, guys. Come on, guys. This is not the question, just for the interest I'm asking you. Yeah. Okay. Okay, apple keeps the doctor away. Good. Sutapa is answering well. Sutapa got the answer. Sutapa is telling, sir, Datura poison. Datura thorn apple. This is good apple. Thorn apple is bad apple. Okay. And this is basically EDH. And this is basically SDH. Now, one more interesting question about banana in sexual jurisprudence. Okay. Sexual jurisprudence. So that you can go through after the class. That's okay. The next question, second question, all of you write the question number, then you answer. You take your own time. Again, the history is, so this is an injury caused by so heavy weapon like hammer. Okay, like this hammer. Hammer and death. Head injury and death. So my question is, identify this and also you tell me about other types of fracture. Other types of fracture. Try to answer. So good, many answered. So many answering. So this is basically depressed fracture. Also known as signature fracture. And commonly associated with hammer. Any object which has small striking surface and heavy weapon, so that is hammer. So this is basically depressed fracture, a case of murder. Okay, good. Then many answered. So the next question, look at this. This is a case of road traffic accident. So my question is, what are important findings about it? What are important finding? Why does it accumulate around the eye? Why not on the back side? Why not on the neck? Why only around the eyes? So this is the question. Anatomical basis of this condition. What is the anatomical basis? Okay, try this. Okay. Okay. So the cause is basically due to head injury or fracture of anterocranial fossa. That's okay. So it's because of anterocranial fossa fracture. Point number 1. It is known as spectacle hematoma migratory bruise. So around the eye, raccoon eye. Okay, that is also correct. Raccoon eye, spectacle hematoma. So why does it occur around the eye? So why not over other sides? So that is the question. So panda eye, that is also correct. Cavernous sinus, okay. Okay, so good answer by see this. Okay. Loose fascia, gravity dependent, okay. There are many gravity dependent areas. Why? Because this frontalis muscle, frontalis muscle, it has a attachment, bone attachment over the back side. So front side it don't have any bony attachment. So whatever that is blood is there, so that is from the forehead, from the anterocranial fossa, it accumulates around the eye. So because the frontalis muscle don't have any bony attachment on the front side, it has attachment over the lateral side and the back side. That is the answer I wanted. Okay, good. So this is about question number 3. So many answered, that's great. Then and try to memorize, it is known as battle sign. One more question is battle sign. So that is the bleeding around the ear, around the masted process. That is because of middle cranial fossa fracture. So there are 4 B's are there. Battle sign, bruises seen, basilar skull fracture, and behind the ear. Battle sign, panda eye, commonly asked in the exam. So the next comes is 4th question. So all of you try. What is this basically? So write the question number 4 and try to answer. So question number here and try to answer. What is this actually? And which is the commonest one? And what is that 1, 2, 3 and all here? What is this 1? What is this 2 and what is this 3? Try this. Try, Srinivas. Okay. So this is basically known as motor cyclist fracture, and this is known as hinge fracture. Hinge fracture. So the answer is hinge fracture. Also known as motor cyclist fracture. So there are three types. Type 1 is most common. So the type 1, so you can see here, I think nobody has answered properly. So type 1, that starts with the petrous bone. So this is the petrous bone, petrous part of the temporal bone. So it starts with the petrous bone. It passes through the sella turcica and goes to opposite petrous bone. So type 1, all of you write petrous and petrous, right? Type 1 is petrous and petrous, passes through sella turcica. Sella turcica. Write this in chat box. Type 1 is petrous, petrous. Write this. And type 2 basically starts with the petrous. Again, type 2 starts with the petrous. It passes through sella turcica. It goes to frontal. So petrous, sella turcica and frontal. Okay. Type 3, you can see type 3 here. It is frontal to frontal. So frontal to frontal, no sella turcica. So this is very important concept. Difficult also. So okay. Type 3 frontal to frontal. Type 1 basically petrous to petrous. Good. So that's why the wearing helmet is very important. Like example here. So this is skull. Hana. In case of road traffic accident, especially motorcyclist, so wearing helmet is very important because it will prevent fracture of the skull and extradural hemorrhage. Okay. So all of you, please wear helmet while driving motorcycle. So cycle, motorcycle or bicycle, any cycle, wear helmet. That is mandatory as per the law as well. So don't neglect. Okay. So this is okay. That's great. So Rakshit Kauri, Vinay wear helmet. Rakshit from Rakshit Srinivas Ramanujan Tota, safety come first. That's great. Yes. Okay. Can you just introduce yourself, guys? So can you just introduce like me? So Dr. Manjunath, MD from MAMC New Delhi. Anna, like that you can introduce yourself so that we can become friends. We can become friends in PW platform. Anna. So great opportunity. Great opportunity. We are emotionally connected. Yes, guys, just introduce yourself. Okay, Rakshit Kavri, Subaya Medical College. Great. Others, just introduce yourself. From Subaya. Okay, Rakshit from Subaya. Vinay. Okay. Vinay from Sims. Okay, Sanjana from Bangalore Medical College, BMC. Great. Mohammad Ayush from MAMC. Oh, MAMC. Okay, MAMC, Maulana Medical College, right? Yeah. Dhananjay from RIMS. So Raichur Institute of Medical Science. So that's great. And others? Sanjana from JJMMC. Sanjana, great. Sanjana Lokesh. Srinivas from, okay. Hemant is from SIMS, Chamarajanagar Institute of Medical Science. Good. Okay, so that's it. Okay, the fifth question now. The fifth question. This is something related to forensic medicine. Something related to forensic ballistic. Death of John F. Kennedy. John F. Kennedy, a former president of US. So he was shot dead. So during some election campaign in US, okay, he was killed. So he got injury, multiple injuries. He got multiple entry wound and multiple exit wound. So we call it as magic wound, magic bullet. So, okay. So the question is, till today, the death of John F. Kennedy and the direction of the bullet is a big question mark. Very big question mark. So nobody knows from which direction the bullet has entered the body of the John F. Kennedy, causing multiple entry wound, multiple exit wound. It was basically the mistake by doctors. So while doing some surgery, what is that basically? Yes, so this is known as Kennedy phenomena. Good. So Kennedy phenomena. So what is Kennedy phenomena? It is inability to identify entry exit wound. Entry and exit wound due to surgical intervention. Due to surgical intervention. So there is one more question asked in Viva. What is Royal-Sima phenomena? What is Royal-Sima phenomena? So this is common in Andhra Pradesh. So in this phenomena, the murderer, so what he will do? So he will kill the person with the help of stab wound. And after the stab wound, he will keep a bullet inside the stab wound. So stab wound. The cause of death is stab wound or injury due to stab wound. And after the crime, he will place bullet inside it. So why? Just to confuse doctors. Just to confuse doctors and police sub-inspector. So just to confuse legal system basically. You know, when cause of death is unknown, when cause of death is not matching with the investigation, the case become very weak. The accused will escape. I know. So this is known as Royal-Sima phenomena. So very commonly asked. Chalo, next. So now I have one interesting question. That is the sixth question. So very famous movie. फ्लावर नहीं फायर है, मैं फायर है, फायर. So my question is, what is this weapon? What is this smooth bore weapon? फ्लावर नहीं फायर है. What is this smooth board weapon? Yes, come on, smooth board, pushpa, pushpa, है ना? Like this, है ना? Pushpa, pushpa, pushpa. So difficult to identify. Aishwarya, smooth bore, I said. Whenever word smooth bore, when lead ball is used. So this is part 1 basically. So in part 1, so he will use probably shotgun. So I think this is shotgun. But it looks like a rifle also. You can answer rifle also, but shotgun. So it's a smooth bore weapon, no lands and no grooves. So when lands and grooves are there, then it is rifled weapon. Yes, good. So many answered. Rakshit Kauri answered, sir, it is shotgun. Good. Shotgun. Great. Now one more interesting question from injuries. Look at this. What is this injury? Oh, what is this? What is happening here? कुछ समझ में नहीं आ रहा है ना? ये क्या हो रहा है इधर, है ना? What is this basically? Look at this. ऐसा क्यों कर रहा है ये? पागल है क्या? क्या है? क्या हो रहा है इधर? जल्दी बताओ, जल्दी. ऐश्वर्या बलिकार. So he's in cold environment, very cold environment. Cold environment. At the same time, he is removing his clothes. ये क्या हो सकता है? Yes, good, good. Come on, say choking. Choking नहीं है. This is not choking. Choking नहीं है. मोहम्मद आयुष, contusion भी नहीं है. Cold, है ना? Exact word. Hypothermia. Okay. What is that? Correct word. I need correct word. So in case of extreme hypothermia, the person presents with hallucination, a kind of insanity, and feeling of warmth from inside because of failure of higher centers of brain. So the person feel a lot of heat from inside, but in general, it is very cold outside. It will aggravate further injuries. Sometimes it mimic like sexual assault. So as a forensic expert, you must know what is this condition. ये क्या हो सकता है? Yes, very good. I think some student answered. Sanjana Lokesh, very good. Sanjana answered correctly. Paradoxical. Sanjana, great. Paradoxical undressing. Then the 8th question. So this is 7th. So please write the question number also and try to answer. So what is this basically? What is this known as? Like this. What is this known as? Come on. So very simple it is. Very simple. Okay. So neck is elongated, somewhat elongated. So hands are flexed. Claw hand like. Elbow are flexed. Knee is flexed. Right? Hip is abducted, somewhat abducted. What is this basically? So is it antemortem, postmortem? You need to write, is it antemortem or postmortem? This is heat stiffening. So this can be antemortem. So this can be postmortem. So this is because of coagulation of protein because of extreme heat. So coagulation of protein at more than 70 degrees Celsius. Okay. So it looks like a boiled chicken. Looks like a tandoor chicken appearance. Tandoor chicken. Okay. So this is boxing attitude, pugilistic attitude, heat stiffening, differential diagnosis of rigor mortis. It has no medico-legal significance. So it's an artifact. Good. That's great. So also there is a opisthotonus. Some student answered opisthotonus. So like tetanus, it can be yes, but not exactly this. So this is basically bone injury. Injuries, bone injuries. Okay. Then the 9th question. So look at this question. Now I am in the booth bungalow. I am in the शव परीक्षा room. तो ये देख के बताओ ये क्या हो सकता है? This is a case of hyperthermia. This is a case of antemortem injury. So he was alive at the time of burn incident. So his total family was saved by him, but he died. So while the process, so he died due to inhalation of carboxyhemoglobin. he died due to asphyxia. So in autopsy, what I can see here, so there is a area of hyperpigmentation, area of soot particle deposition, and it looks like antemortem injury. So can anyone tell me what is this appearance known as? Hemant and others. ये क्या हो सकता है? So very good. Hemant answered correctly. Hemant, excellent answer. So the first answer is by Hemant. Crow feet sign. So this is the area of soot particle. This is the area of hypopigmented area. Hypopigmented area. So because of the pain, so because of the injuries around the eye, he's closing his eye very tightly. So because of the antemortem contraction, there's a deposition of soot particle in some area, but in some area it is totally absent. So what happens after death? So there is a relaxation of all the muscles. So that's why this is clearly visible after death. So this is classical case of antemortem burn injury. This is known as crow feet sign. Crow feet sign. Okay, Mohammed, you answered. That's great. That's great. That's okay. Good. Soot particles. That's great. Then the last question. Now again, now you are forensic expert. You are my student. You are forensic expert. Now you are in Shava Pariksha room. Look at this now. Identify what are these injuries are there in case of burn injuries. So what are these? Okay. And you let me know what is the cause of death in this case, probably. Okay. So write the question number 9. Okay, like that. So it should be question number, okay, it's question number 9, and try to answer. So this is again case of burn injury. So in Shava Pariksha autopsy, so what I found these findings. It's a case of dowry death basically, ATBNS, and during examination we have some specific findings. तो आपको बताना पड़ेगा ये सब क्या हो सकता है. Is it scald? So it can be scald, yes. So this feature is basically line of redness. Line of redness. So this is antemortem. Antemortem. Then you can see here blisters. So blisters containing protein. Antemortem. So there is no putrefaction here. There are no signs of putrefaction. So it must be antemortem. Then what we can see here, tattoo. So by look at the tattoo, can you tell me about the religion? Religion? Yes, you can tell about the religion. You can tell about the mental status of the person. And also when tattoo is not visible, you can dissect lymph nodes. And dissect lymph nodes. Okay. Good. Srinivas is telling, sir. Identification, religion, good. Hindu hai, ठीक है ये सब. Okay, female ring. Okay, female ring is there. That's great. So you can see here female ring is there. So probably she is married. And dowry death, ATBNS, death of female within 7 years of marriage. All this we discussed, right? So this is how you should solve the crime mysteries. Yeah, is it interesting, guys? Is it challenging? Like this Booth Bungalow series, which I started today. Is it interesting, or what is your opinion about it? Shall we continue the same Booth Bungalow series in upcoming classes, upcoming YouTube classes, or upcoming batches? Booth Bungalow series. Booth, Shava Pariksha, Bungalow, Haunted House series. Rakshit. So shall we do some more in upcoming classes? Booth bungalow, like this interesting case scenarios, which is from various parts of India. Or I have vast experience of forensic medicine, collection of lots of videos and all that I can discuss in upcoming classes. Okay. Some videos are not allowed in YouTube. So otherwise I would have show you some real videos. So anyway, we are forensic experts, you are doctors. We must know everything about life, everything about death. We are expert. We should help our judiciary to find out cause of death. So that is the motive of these classes, nothing else. Okay. Okay. Rakshit. Thank you all. Thank you guys. Aishwarya, Baligar, others. So now last question for you. Last question. So last question, guys. Now again, booth bungalow series. So now I am in Shava Pariksha room. Chalo. Now look at this. So I got some injury here, some injury here, some injury is there. History is not there. Okay, history is not given to you. Okay, there is also injury, basically over the fingers. Okay, like this, fingers. So this is the case of basically electrocution. So because of the electrocution, because of the AC or DC current, because of the ventricular fibrillation. So my question is, so what is this condition basically? This is question number 10. You tell me what is this basically and what is the feature of that? What is the feature of that? How it looks? Okay, good, good. So this is basically electrocution. So electrocution, AC is dangerous than DC because it causes tetany. So ampere is very important than voltage. The very important barrier is skin. So the skin is a very important barrier. That's why when you touch electrical equipment with a moist skin, it is very dangerous. So never touch electrical plugs, electrical switches, especially the geyser and all. So with wet hand, don't use. There will be sudden electrocution and death. I have seen many cases in my experience. Many cases. In one case, one medical student, he was found dead. So in a room, and due to electrocution, and during crime scene investigation, what I found, he was totally naked, no cloth on the body, naked, and his totally body was wet, and there was a I think some electrical instrument, it was actually on at that time. So basically that is iron box, it was on. So he was about to go to his 4th year classes, and he was taking bath around 8 o'clock, I think 7:30 a.m. in the morning. So it was very interesting case and very sad story, because the medical student basically. So but very what is there actually, so he was naked and it was resembling something else. Okay. So basically the moist skin that will attract the electrocution, the death occurs immediately. So that is the point here. And this is basically endogenous burn. Endogenous burn, also known as Joule burn. Joule burn. So in endogenous burn or Joule burn, what you will see? So like this, you will see 3 layers. 3 layers. So when you examine closely, you will see black at the center, brown at the periphery, somewhat gray at the surrounding, and there will be crater formation. Crater. So this word is important. So crater formation in case of endogenous burn. Usually it is contact burn. So usually low voltage burn. So that is household current around 240 voltage. So what happened in that case? So he was touching his iron box with he was alone in the room. He was getting ready for the classes around 7:30, 8 o'clock. So he touched that electrical instrument iron box, and he died immediately due to electrocution. And room was locked from the inside. No history of any poisoning, no history of cannabis, no history of alcohol, nothing. Who will take alcohol in the morning? They will take it only in the evening time, no. So by looking at the circumstances, so we solved the case, probably a suicidal case, probably accidental electrocution, okay, accidental electrocution, not suicidal, okay. So low voltage current, good. Then in that case also we got one more injury. So this is the injury which I got. So look at this, this is there on the sole, okay, sole. Can anyone tell me what is this finding? Entry wound or exit wound? And look at this, these are multiple in numbers, multiples, and they are averted. So this is not very commonly seen. In say 100 cases, in my experience, it is visible only in the around 50-60% of the cases. Okay, so this is basically exit wound. Exit wound. This is exit wound. Okay, rarely. Sanjana. Now, electrocution can be suicidal, medico-legal importance, MLI. So it can be suicidal, especially in alcoholics. You must have seen in Instagram reels as well. Alcoholic person, true insanity, love failure, psychosis and all, suicidal, rarely. So it's very painful death, suicidal injury, very painful death. Then sometimes it can be homicidal. So in my experience, around 5-6 cases of homicidal electrocution. So in one of the case, like wife was murdered by the husband, and he kept water heater, so along with the dead body of that female, and he was telling the police and others, and he was telling it's basically accidental death. So later we came to know, so there was a ligature mark, there were injuries on the body. We came to know it was not the case of electrocution, it was the case of murder, homicidal. Sometimes it can be accidental, then it can be judicial also. So judicial in USA. So they will place electrodes. So like this, they will place electrodes. Okay, look at this. This is electrode. All of you are getting my point? Is it funny? Look at this. This is electrode, and they'll place electric current like this. So this is how it is basically judicial electrocution. So what is the cause of death? So cause of death basically ventricular fibrillation or respiratory paralysis. Ventricular fibrillation or respiratory paralysis, depending upon the case. So in high voltage burn, you will see crocodile bone injuries. We discussed already multiple bone nodules, high voltage burn, more than 1000 voltage. And in electrocution, you will see melting of the bones, calcium and phosphate. That is known as candle dipping appearance. There can be degeneration of the muscle. There can be electrical petechiae over the heart. So there are other findings, non-specific findings as well. So there will be findings of asphyxia, petechial hemorrhages as well. So this is about the case of electrocution. So now there's a last question for you. You just tell me what you are going to learn from this beautiful video of beautiful video of firearm mechanism. You just let me know what is that is there. So it's difficult basically. It's basically PG topic. So just go through this and you just answer. Later I will discuss. Okay. Look at this. Look at this video. Okay. Fine. Good. So this okay. So what you can see here in this image, basically this video, the mechanism of propulsion of the bullet. How basically? So it starts with the primer. Starts with the primer. So the primer is made up of barium, lead stiffenate, antimony, and all. So when primer causes combustion of gunpowder, So when there is a combustion of gunpowder, so there will be production of gas. Like example, 1 gram of gunpowder, 10 to 12 liters of gas. 1 gram of black gunpowder, 4 to 5 liters of gas. So there will be production of 4 to 5 liters of gas. Hello guys, concentrate. The answer suniye. Small barrel, production of 10 to 12 liters of gas. Look at 10 to 12 liters. For example, this is a dummy pistol. So this is a barrel. So inside this very small barrel, around 10 liters of gas. 10 liters of gas. What happens basically? So the bullet moves automatically at very high speed. So it pushes the bullet. And there will be movement. So there will be movement. So who is the hero? The hero is gunpowder. So all of you write in the chat box, the hero is equal to gunpowder. Hero. Who is the hero of Kantara? Rishabh Shetty. Like that. Who is the hero of forensic ballistic? Gunpowder. Okay? Hero is equal to gunpowder. So hero होगा, सब कुछ होगा. Hero नहीं, कुछ नहीं. बस. Boring है. समझ में आ रहा है आपको? So this completes your lecture. So around 2 hours. So you all are very attentive. I'm very happy about it. And tomorrow there is no class. I'll get to know the next class. We have 5 more classes in forensic ballistic. So this completes your ballistic. So if you have any doubt, you can ask me. So for next 5 minutes, I'm there here. You can ask me. Okay, Sutapa. I'll let you know. Hemant. Okay, age from X-ray. Done, done. Rakshit. Sure, sure. Vinay will talk about it. Sure. These videos are compulsory. So you can just watch these videos at 1.5, 2x speed, prepare notes, and no problem. No problem. So it is basically concavo convex. Concavo convex. SDH, concavo convex. So next class probably medical jurisprudence. We'll be having a very interesting scenario, okay, like courtroom procedure, lawyer, doctor, judgment and all. You will definitely enjoy that. Asphyxia already over. Rakshit, asphyxia already over. This is the third class. Asphyxia over, sexual jurisprudence over, and injuries over today. Yes, Vinay, thank you all. That is over, Rakshit, already. Thank you all. Thank you. Sure, sure. Thank you all. Good. Happy reading. Bye.